Okay, and for today's episode of Rare, we have Ellen Thomas speaking to us. So Ellen is the Chief Medical Officer at Genomics England, a global leader in enabling genomic medicine and research with a vision of creating a world where everyone benefits from genomic healthcare. So it was established in 2013 and is owned by the Department of Health and Social Care. So welcome, Ellen. Can you talk us through your journey so far?
Yes, thank you very much for the invitation, Laura. Delighted to be with you. I am a clinical geneticist by background. So I trained at centres in London to work with families with rare conditions. And I then did a PhD in how to use DNA sequencing techniques to really look for the cause of rare conditions. I've now been at Genomics England for nearly 10 years. So I joined back in the days when we were doing the 100,000 Genomes programme, and I now look after our NHS-facing work at Genomics England. So that covers both the work that we do on the diagnostic front with the NHS Genomic Medicine Service, and also the Generation Study, which is the flagship programme in our newborn genomes programme.
Mm-hmm. Great. Well, could you tell us a little bit more about Genomics England?
Yes, of course. So as you said, we were set up back in 2013 to deliver the 100,000 Genomes programme. And that was really a research study, which was looking at how you can use whole genome sequencing to try and better understand and diagnose and treat rare conditions and also cancers. So patients joined the programme from the NHS and made their data available in a de-identified way to researchers in what we call the National Genomic Research Library. And that programme was a great success. We have diagnosed thousands of patients, provided a research data set which has informed a lot of academic publications and understanding about how we use genomics in healthcare. We then continued to move on after the 100,000 Genomes programme to offer diagnostic whole genome sequencing services to the NHS Genomic Medicine Service. And we also continue to look after the National Genomic Research Library and continue to increase the data set there and increase the richness of the data there for researchers in academia and industry to understand the basis of rare disorders and cancers and think about how we can treat them better.
It's great. And so I actually recently saw you feature on a news channel in the UK, which is why I reached out to you. And you were talking about the Generation Study, and you did mention it a little bit earlier as well. So what is the Generation Study?
Yes, we recently had the formal launch of the Generation Study, which is a new research programme, and it is designed to provide evidence on whether and how we should use genome sequencing in a new context, namely instead of looking for rare conditions after a baby or child has presented with symptoms, we're looking at whether you can carry out the genomic test at birth and then look for rare conditions which haven't yet presented, haven't yet caused that baby any symptoms. And the goal of this is really to try and do more for children with rare conditions and their families by achieving earlier diagnosis and then access to potentially life-saving treatment. So the programme has been carefully designed with extensive engagement and consultation with families and patients and families with rare conditions and parents and prospective parents to understand how people feel about using genomics in this rather new context for babies who don't have any symptoms. Mm. So we're now we're live in a number of hospitals around the country, and we have babies and families joining the programme. We're taking those samples and analysing them for conditions which can be treated early in life. So the programme is also going to support some further research aims. So we're also gaining consent for the information to be available in the longer term to researchers to really understand about genomics and how genomics can be useful to babies and families. If you have that information available earlier in life, what other sorts of questions could you ask? So again, the data will be made available in a de-identified way to researchers to help understand and think about how we treat rare conditions.
And it's just such valuable research, because everyone knows across the rare disease space that the earlier the diagnosis, the better, really. So how were the conditions that are being tested for in the study chosen?
The conditions were chosen based on the engagement work that we did with the public, with patients, with parents in advance of the study when we were co-designing the study. So we asked people what they felt was the appropriate use of this kind of test, and people felt that it was important that that when we look for a condition, that we could do another test to check that whether the baby genuinely has the condition or not, so that the families would be able to immediately access NHS care to confirm whether the baby definitely has the condition, if it looks as if they might have a condition based on their genome, and then very importantly that there is something we can do about it. So all of the conditions on the list have some kind of treatment or intervention or action which is likely to improve the baby's health if the condition can be picked up before the baby develops symptoms, and that treatment or intervention started at an earlier stage in life. So it's really trying to prevent harm to those babies from the conditions that they have by detecting them earlier. And that was very much the feedback that we had from the public when we talked about this study, that was the area where people felt comfortable with using this data to investigate how genomics can be useful in this context.
Yeah, that's great. Well, yeah, thanks a lot for taking the time to feature and to tell us a little bit about the study. I will provide more information after the blog as well for anyone that wants to look into and research themselves about Genomics England and the generation study. So thanks a lot, Ellen, for taking the time to feature.